Well, as we enter the summer season, COVID may not be as top of mind as it's been for the past 2 years. Fewer people are wearing masks, and many people have caught and recovered from the virus. But as immunity starts to wane, some are asking about when they can receive a second booster. In this province, only people who are living in congregate living facilities, are Indigenous, or 70 plus qualify for a second booster. But some other provinces have lowered the age of eligibility for a second booster. For example, in Quebec, anyone 18 and over can get a second booster. Joining me now to talk more about this is Chief Medical Officer of Health, Dr. Janice Fitzgerald. Thanks so much for making time for us.
Thank you.
Well, we've been hearing from some viewers who'd like to get a second booster. They're worried about waning immunity, but they're under the age of 70. Have there been any discussions about opening up the second booster for those under 70?
So certainly discussions about second boosters and vaccinations in general have been ongoing, and we're all sort of looking to see how things will have to go in the fall. And it's no secret that we've all said that we expect to see some surges in the fall, and certainly we want to prepare for that. So yeah, at the moment, we're certainly following the evidence that says that people who are in the groups that you just listed off certainly are at higher risk for more severe outcomes, and should have that second booster as well. People over the age of 70, as well as those in congregate living facilities. Elderly people in congregate living facilities can have less of an immune response to vaccines, and so that waning may happen. Maybe a little more prominence, and so we want to make sure that we're providing them with the best immunity that we can at this point.
And can you explain a little more about the reasoning behind the age limit? Like, what does the science say about giving a second booster to people who are under 70? Because in the United States, for example, people 50 and over can get the second booster, and some other provinces have lowered the age, as I mentioned as well. So what is the science behind that?
So basically, there's not a lot out there, is what the thing is, and so those that information is coming in more and more all the time, and I'm sure as time goes on, we'll have that information, and I expect that we will be seeing some of that information fairly soon, and then be able to make some decisions about how we have to go with the rest of the booster program.
How concerned should people be about waning immunity?
Waning immunity is something that naturally happens with us. There are some vaccines that provide very, very good immunity that essentially lasts lifelong, and but unfortunately, viruses like coronavirus and flu viruses, that doesn't happen. So we all need to be aware that waning immunity is happening, but that's not to say that you don't have any immunity. And certainly, we're still seeing that there is good protection against severe disease. So while it may not prevent transmission, we're still seeing good protection against severe disease several months out.
And I'd like to ask you about wastewater testing, because there's been an increase in virus levels in the wastewater that's been tested. Can you talk about what kind of levels are being found and what that tells us about how much virus is still circulating in the community?
So yeah, we are seeing higher levels, but one of the things we have to consider with wastewater is that the actual flow of water that's running through the wastewater system can actually influence your concentration of virus particles, and so we have to take that into consideration. So if the flow is lower, does that have any effect on it? So that may be part of it. We are seeing a little bit more. A little bit of a bump in cases right now. It's not a huge bump, but we are certainly seeing a little bit. And so I'm not surprised that we're seeing a little bit more virus in the wastewater, but certainly what we're seeing at the moment is still very manageable. It's manageable from a hospitalizations point of view. We're not seeing a huge increase in hospitalizations. And but it's going to take us a little bit of time to sort of look at wastewater and circulating virus, and what does that mean? How do the two correlate? It's not it's not quite as simple as just looking at the numbers, I guess.
What are your predictions for the fall? As I mentioned, more and more people seem to be ditching the masks in public. People are still getting sick and dying, and there are new Omicron subvariants overseas that some folks are worried about. What do you see happening in the fall when we enter flu season again and we're all back indoors and the virus can spread more freely?
Yeah, so you're just giving me like panic attacks here now.
Sorry.
So I think, it's not really my prediction. I think, the modeling is certainly indicating that we probably will see another surge in the fall. What that looks like exactly, it's difficult to tell at this point. Obviously, if what we're dealing with is a variant that's very similar to Omicron or one of the Omicron sublineages, well, we've dealt with that. We know what we have to do, and we'll have processes in place to be able to deal with that. If we're not dealing with an Omicron variant, and we have something that has, that has immune escape or is more transmissible, for example, then we're going to have to rethink how we deal with that, and we're developing plans about what do we do in those kind of worst case scenarios versus what do we do if we have what we have now. And the big key right now to living with COVID is, to make sure that you get your full primary series of vaccine and any boosters that are available to you. And, we'll have, I'm sure, more information about that as time is going on.
Well, Dr. Janice Fitzgerald, really appreciate this update. I hope you have a nice and relaxing summer. Thank you so much for this.
Thank you. Take care.